Dr. Tani Ping, consultant obstetrician and gynecologist. Okay, so today I'm going to talk about hysterectomy. Do you all know what's the meaning of hysterectomy? Hysterectomy is a procedure to remove the uterus. So there are many reasons why people need to go for hysterectomy. This is a procedure many women fear that they one day need to do it, and many women will try to avoid having it done. Okay, so first of all, I'm going to introduce myself. I'm a consultant obstetrician. One thing I know about myself is I tend to be very conservative. I'm one obstetrician or gynecologist that hardly take people's uterus out. The least of all, you can think about it. I do a lot of surgeries, but I tend to conserve. Why is that so? I will explain later in my talk. And that's why often in the hospital, that's what I get. I get nurses asking me, scrub nurses asking me. Even I remember once the sister of the ward asked, they call it not the ward, but the operating room, she asked me, "Doctor, why take out the fibroid, not the whole uterus?" So you see, why do they ask me? Because very often they see a lot of other doctors tend to remove the uterus in this type of situation, but I tend to preserve it. So I'm one of those very conservative doctor. I don't usually make it like, oh, you must do a hysterectomy, because very often there is always other options. So that is the thing, and that's what I'm going to talk about today. So before I talk more about hysterectomy and how you can avoid it, I'm going to just give a bit of short intro about various type of hysterectomy. So you must understand, hysterectomy means removal of the uterus. You can remove just the uterus or a lot of other things with it, or the whole uterus or not the whole uterus. So first of all, you can remove the whole uterus, or you can remove half the uterus, leave behind the lower part of the uterus. So this is a different type of hysterectomy. We have total hysterectomy or subtotal hysterectomy. A lot of women like subtotal. Later I'm going to explain why. So you can either have a total hysterectomy or a subtotal hysterectomy. Then when you take out the uterus, you can choose to take out one ovary together or both ovary together. So you see, you got many options. So even if a doctor asks you to do a hysterectomy, you can actually think about the various options you have. So you can just remove half the uterus or the full uterus. And whichever one you decide, you can choose to remove one ovary together with the uterus. You can also choose to remove both the ovary together with the uterus. And in certain cases, you may need to remove all the lymph nodes around the uterus. And usually that is for cancer surgery. Okay? So there are different types of hysterectomy. And hysterectomy also got many ways of doing. You can do with a conventional open surgery, where you open up the tummy and take out the uterus. You can use laparoscopic. That means I put 3 holes in the uterus, 3 tiny holes in the uterus, and I also remove the uterus. 3 tiny holes on your tummy, and then I remove your uterus. You can also do robotic, which is something like laparoscopic, just a few holes on the tummy, and then you remove your uterus. You can also do vaginally. That means nothing on your tummy. I go from below and remove your uterus. So even for laparoscopic, we have a single site laparoscopic, which is only 1 hole. You can have 3 holes to remove your uterus. You can also have 4 holes to remove your uterus. You can also have 1 hole to remove your uterus, and which is usually at the belly button to remove your uterus. So there are many ways of removing your uterus, and many people do not know that. When I tell somebody that they have few options, many of my patients will tell me, "But I want to remove my uterus, means I need to do open surgery, right?" Oh, no. Why remove uterus must do open surgery? No need. You can do just a pure vaginal surgery, which doesn't need to open the tummy at all. Or you can do a laparoscopic surgery or a robotic surgery. You can still remove the uterus. Then many also were curious, so small the hole, how to take out the uterus? Yeah, because in laparoscopic or robotic, your holes can be just 5 mm or 8 mm or even maximum we can go up to maybe 1 centimeter or 1.2 centimeter. But your uterus is like, 8 centimeter, 10 centimeter. How to come out from the small little hole? Oh, don't worry, doctors can do magic one, okay? That is what came with the advancement of laparoscopic and robotic surgery. We have few options. Women who have given birth before, after we complete the whole surgery, we actually remove the uterus from vagina because your baby so big also can come out. How big can your uterus be? Nobody has a uterus as big as a baby one, okay? So that is for women who have given birth. Women who have not given birth, I can still do that, but maybe I need to cut the uterus into half first. So normally what we do is we cut into half, then we take half by half out. That is also possible. But in some women, maybe if they didn't remove the entire uterus, which means that lower part of uterus is still intact, so I cannot take down from below, or they are single and their uterus is so big, even vaginally cannot come out. So what happens is that we will morcellate. We morcellate, but in the modern times, we usually morcellate with contained morcellation, we call it, where we put the whole uterus in the bag, and then we put it in a machine like a blender, and then make it everything to small pieces. Then we will pull it out one by one, all done within the bag, so there's no spillage into the tummy. So everything is inside the bag, and the bag is inside the tummy. So after everything taken out through the 1 centimeter or 12 millimeter wound, then when we take it out, then only I remove the bag. That's how I complete my surgery. So you can see, however big your uterus, we can still do it with just 3 small holes. Typically it's 3 small holes, single side 1 hole, robotic is 4 holes. And some laparoscopic doctors also do 4 holes, but typically it's around that. You can do removal of uterus no matter how big it is through laparoscopic or robotic, okay? So you do not need a big wound to open your uterus. So let's go back to what I said earlier. We have subtotal hysterectomy and total hysterectomy, and you can remove the ovary or without the ovary. So I'm going to show you one picture. This is a picture that you can get from Google. So this is the uterus. So if you see, this is subtotal. The lower part of the uterus is left behind. This will be total. The entire uterus is taken out. And last of all, we take out the uterus plus the ovary. Okay? So you have 3 different types of hysterectomy that you can choose from. Of course, some people will take 1 ovary instead of 2 ovary, which is all possible. So remember, you see, you can take out just half the uterus, or the whole uterus, or you can either half uterus or whole uterus with 1 ovary, or half uterus, whole uterus with 2 ovaries. It all entirely depends on 2 things. One is why you remove your uterus, and second is what do you want, because each and every type has different changes that you may need to face. So we need to let you know what you want. Why I tell earlier, I did mention a lot of my patients would choose subtotal. And in fact, I always give this patient option to most of my patients who plan to do hysterectomy. Or there are some women, when you tell them hysterectomy, they will say no, I'm not removing your uterus. I'm not removing your uterus. And I usually understand why. They either worry about removing uterus, they will get old. They worry about removing uterus, no more hormone. They worry about sex life. They worry about a lot of things. They feel that having menses is probably the best thing for a woman. So these are the women that I typically would offer them. Do you know there's such a thing as subtotal? That means you don't need to remove the whole uterus. Why? Because if you don't remove the whole uterus, number 1, I can still give you menses every month. So you can solve your problem but still have menses every month. So in this type of situation, then many of them may actually agree on the surgery. At first they didn't want, even though actually they cannot want. They have reached a state where they are suffering so much. They reach a point where they need to remove, but they still hold on. I've seen many women suffer for years and years just because every doctor they go to, the doctor asks her to remove the uterus. And true, maybe when you look at her case, she really need to remove her uterus, but she doesn't want because she fear what's going to happen to her when the uterus is removed, which I totally agree, because being a lady, I can think of what can happen, and then that is the reason why they keep refusing the surgery, even though the condition get worse and worse and worse over the years. But the moment you tell them there's an option of subtotal, then they are always very shocked. There's such a thing, I don't need to remove my whole uterus. I can still have my menses every month. Oh, that is what they'll be surprised. So first of all, we need to think about why, maybe I put it last, okay? Let's talk about diseases. In what situation do people really need to remove the uterus? As I mentioned earlier, I'm quite a conservative doctor. I tend to keep the uterus rather than removing the uterus. But there are certain situations maybe we don't have a choice. Or the best option is still removing the uterus, even if there may be a choice. So let's talk about diseases in general, one by one. Number one, we talk about cancer. Whether you have uterus cancer, cervical cancer, or ovarian cancer, or cancer of your fallopian tube, the answer is quite simple to most doctors. It's like, you have to remove your uterus, you have to remove whole uterus, you have to remove your ovaries and everything. It's quite straightforward to most doctors. For most women. Remember, I use the word most, I don't say all. So why? Because as long as it's possible to do it, that's what all of us want to do, because that gives you a complete clearance of disease and gives you the best survival. Makes treatment a lot less complicated, less use of chemo and radiotherapy, which is best for you. So in cancer, very often we have no option, but not really also lah, because we can see cancer in young girls. You have a 21-year-old girl with cancer, then the whole story changes. We are more conservative. We will try to keep some things so that hopefully she can still bear children. But having said that, she will have to understand the risk that she's going through. So it is not a must, but if you are going to have all these problems, the best option is still cancer. Best option is still to remove everything. Then let's not talk about cancer now. We talk about things that are non-cancerous. Fibroids. Up to a state where you are bleeding, you have so much pain, is it a must to remove the entire uterus? Let's talk about fibroid. The only thing why we remove uterus, to many doctors, they feel that you need to remove the uterus, is because we worry that the fibroid will grow back. So, number one, if a woman comes to me with fibroid, I will first assess whether the fibroid is one fibroid or many fibroid. If you have one fibroid only, the chances of it growing back isn't that high. We notice a lot of women are like that. If they have one fibroid, they tend to just live with one fibroid. If they have many fibroid, then it's an endless story. If you have 5 fibroids, 8 fibroids, 10 fibroids, the fibroids are just going to increase in number. The more you delay, the more they grow. And if I were to take out all the fibroids today, tomorrow there'll be new ones. Those with multiple fibroids just keep increasing. So, of course, the logical sense is, if I remove all the uterus, that would be the best. Why we want to face with new fibroids again and again and again? But it is not a must. And to me, ultimately, it's not my choice. It's the patient's choice. So I will just tell them simple. You have so many fibroids. So if I were to leave the uterus behind, guarantee grow back. Guarantee grow back depends on whether how old you are, whether how fast it's going to grow back. If you're lucky, let's say if you're in your 40s and it doesn't grow back so fast, by the time you menopause, fibroid settles. So maybe that is only your one last surgery. If let's say you choose to keep your uterus, you must understand fibroid, you can choose to take out fibroids only or remove the whole uterus. So if you want to keep your uterus, you need to understand that you have to be prepared that it will come back. Number 2, that is the main thing you need to prepare. And depending on your age, if you're young, it's going to come back. you have to be prepared that you probably will need another surgery. So these are the things you need to prepare. Some women don't mind. I have patients who have so many fibroids. They first operated maybe in their late 20s. Of course, late 20s, nobody will ask you to remove the uterus, right? And then she also did it either laparoscopically or robotically. And she feel that removing the fibroids is not really suffering because laparoscopic after 1 week can go back to work. So she finds it's fine. After 10 years, it grew back again. Now she's 39. And then we give her the option, either you remove the whole uterus or you remove the fibroid again. Then some of them will actually choose to remove the fibroid again because number one, they don't find it that suffering. Number two, it took 10 years before it grew back, so they're hoping another 10 years they're 49, hopefully menopause by then. But if they're not menopause, they also don't mind facing the surgery again because the surgery wasn't that suffering to them. Okay, so in these women, it's again their choice. It's not my choice. It's not my choice. It's your choice. It's not cancer Nobody say must remove the whole uterus. But I always give them the third option. So you got first option is remove the whole uterus. Second option is to remove just the fibroids. Third option is subtotal, which I mentioned earlier. We can remove part of the uterus with all the fibroids, and leave behind little bit of the uterus, the lower part of the uterus that doesn't grow fibroid. And by doing so, then you still can have your monthly menses. Subtotal, usually I give the patients option. You want monthly menses? You don't want monthly menses? Anything also can. We will be able to do it one. So if she still want monthly menses to make herself feel good, then it's all possible. So that is fibroid. Second, we want to talk about endometriosis. Endometriosis per se, actually uterus doesn't play a role at all. In endometriosis, the main problem is the ovary, not the uterus. You take out the uterus, if you leave behind the ovary, no use. So in endometriosis, when you take uterus out, you will want to take the ovary together. So if you take the ovary together, then there is a big impact because when you have no ovary, then you have no hormone. You still need to think about long-term consequences. So when it comes to endometriosis, very, very rarely do I take out both uterus and ovary because we have to, when you want to take ovary, I'm very conservative one. Because to me, I need to think about the long-term consequences. And for endometriosis, got medicine after surgery to prevent endometriosis from coming back. If you listen to all my endometriosis talk, I always talk about after surgery is medicine. So if I do a conservative surgery, that means I need to take out your endometriosis, but I leave your uterus, I leave your ovary behind. But you go on long-term medication, the thing is not going to come back. So you don't have to remove all the uterus and ovary. And by the time menopause, your problem settled. And your ovary is still there to function until you grow old. And what else? Yeah, the trick is adenomyosis. Adenomyosis is a disease of endometriosis in the uterus now. So you have disease of endometriosis in your uterus. And adenomyosis, yes, there's no way you can get rid of adenomyosis permanently without removing the uterus. So for adenomyosis, main thing is still the uterus need to go, unless, number one, same, I can use medication to control. After the surgery, let's say if I remove your adenomyosis or adenomyoma and then I use medication to control for the rest of your life until you menopause, yes, it's possible. Or you can again opt for a subtotal hysterectomy, whereby part of your uterus is still left behind, which actually serves a lot of purpose as well. Okay? Then, other than that, will be all kind of ovarian cysts. All the other cysts that you're going to get, it all depends on whether we think it's cancer or not. If it's not cancer, uterus doesn't need to go. You only need to remove the cysts. Or in certain cysts, you may need to remove the ovary because the risk of cancer is high. But still, the uterus is not necessary to remove unless we think it's cancer. Okay? So basically, that is roughly how we, most of the cases that needed to do hysterectomy lah. Okay, now I'm going to talk about all the pros and cons. Total hysterectomy and subtotal hysterectomy. What is the only difference? There's only one difference. Other than the fact that, okay, I can give you menses. Yes. Subtotal can be with menses, without menses, depending on what you want. We can remove the part, leave behind part of the cervix, and remove most of the uterus and leave behind just the cervix, then most of the time you do not have any menses. Even the area in the inner part of the cervix, you can burn it, then you have no menses. But if you prefer menses, then we can always leave a bit of the uterus back together with the cervix, and you will still have your monthly menses. But your menses will never be heavy anymore. Fibroids don't usually grow back anymore if you have such little uterus left, and adenomyosis also will not come back. So it solves all the problem, but it gives you one advantage when you leave behind part of the cervix. That is, other than it can give you menses, actually is sex life. Because sex life is affected by the cervix. There will be some people who will tell you that after hysterectomy or inside empty one. Actually, why they say empty is because whenever they have sex, they really feel empty. Because when you have intercourse, right, whenever your husband go in, it actually hits onto the uterus and the cervix. So because there's something to hit on, so you actually feel your husband hitting you, you see. So you actually feel it. So this sex life actually affect women, not men. Men sex life, nothing to do with uterus. Men's sex life is the muscle around the vagina. As long as the muscle around the vagina holds on to the husband's penis, that's enough. It doesn't have to have the uterus. But for women, it's the uterus. So when I ask women, they ask me what's the difference, subtotal and total. I will tell them, easy. Is sex important to you? If sex is important to you, then cervix is important, no? If sex is not important to you, then cervix is not important, no? Because women, many kinds, some women really enjoy sex. So we also do not want them to lose their enjoyment just because they remove the uterus. But some women never enjoy sex all her life. So she may not find having a cervix beneficial at all. So it's her choice. Then there's another story about people talking about once you remove your uterus, or no more hormone, you'll be dry. Or no, hormone, nothing to do with uterus. Hormone is ovary. So that's why earlier I mentioned you can remove uterus with ovary, with one ovary, with two ovaries. It's entirely up to you. But once you remove both your ovaries, you lose all your hormones. And these hormones is not just when you're young, but for the rest of your life. Ovary does release hormone for the rest of your life, even after menopause. After menopause, there is still some hormone being secreted by the ovary. But those hormones doesn't function in giving you menses anymore, but it still maintains your health for the rest of your life. That's why one thing we know, studies have proven, women with ovary and women without ovary. Women without ovary tend to have a shorter lifespan. Why? Because they have a lot of illnesses that will come because they do not have an ovary. That is why it's very important to maintain an ovary, minimum one. No? That's why, because of all these reasons, I tend to be a bit more conservative with my surgery for removing uterus. I tend to not remove uterus unless we have really no choice. I mean, I usually give patients the option. You can remove, you can do want to remove, and all the pros and cons lay to them and let them decide. But there's still one more thing that why removing uterus causes a lot of problem in women as well. It's not physical reason, but psychological reason. Women always feel that when they remove the uterus or they don't have menses anymore, they are very abnormal. And this type of abnormality makes them think a lot of things. I tell you, when you remove your uterus, you will start to think all sorts of things. You will start to feel a lot of discomfort here and there that may not be relevant. You will also feel like as though your husband is not enjoying sex anymore when the husband starts to have sex less with you. And you will feel a lot of insecurity, like your husband may find that you're no longer a woman or you're no longer adequate for him. For those of you who have not gone through it, may not realize it. But when you go through it, I tell you, most of us will have this type of thinking. And this type of thinking can make a healthy young woman go crazy. Start to have so much negative thoughts, start to become more emotional, and go into depression and anxiety. These are the things that we do not want women to go through. So that is why these are the things sometimes you have to lay it to them. So sometimes when women ask me or the husbands ask me, what's so bad removing a uterus? These are the things I tell them. You have to be sure that you are not going to be affected both physically and mentally. Mentally, if you know you are strong, you're the type that are very clear about things, then you find that they are fine one. Because I have seen a lot of doctors, especially who remove uterus, you find they're so well one. Because doctors, they know exactly removing your uterus, what happens, what does it cause. They know it doesn't cause you no hormone. Your hormones are still there. They know it doesn't cause sex life. They know it doesn't cause your husband feeling less or inadequate. They are very confident in themselves. They go through after the surgery well and fine, no problem. But non-medical doctors, the women who are non-doctors, they hear a lot of things. They listen to their moms, their cousins, their friends, they read papers, they read Google, and they believe things that are not necessarily true. And as a result, they actually believe. They believe. And when you believe, it actually happens. They actually find that it actually happens to them. And that can make them very stressed and depressed, so which is not necessarily good. That is why I'm very conservative. To me, you only need to remove your uterus if you really, really have to. In most situations, it is not a must. The only time it is a must is usually only cancer. And that is also if you have reached a certain age. Very, very young girls with cancer, we still try to be conservative. But unfortunately, when you're conservative, definitely you need to have more chemo and radio law. So if you have reached a certain age, we want to minimize chemo and radiotherapy, right? So then we need to remove your uterus. Cancer is probably the only reason where removing your uterus is a must. Every other thing is not a must. But if you need to remove your uterus, or you think that it's best to remove your uterus, just bear in mind that you have many options. The option is not just one. You can do subtotal, total. You can remove one ovary, you can remove 2 ovaries. You can do open surgery, you can do laparoscopic, you can do robotic, you can do vaginally. So you can think about all the options before you commit to one option and then later regret. Okay, so think carefully. So I hope my current talk enlightened a lot of you about the options available. So as I say, most of the time, removing uterus is not necessary one. Okay, except in cancer surgery. Okay, if you have any questions, please put it up. I'm going to go through some of the questions that I saw earlier on. One of you asked, subtotal can still have menses or without menses? Yes. Oh, okay. When you have subtotal hysterectomy, one thing you must know, you can't get pregnant anymore lah. You can have menses but without getting pregnant. There's no way you can get pregnant already. Okay, but you can still have your menses every month if you want to have your menses. You have low ovarian reserve due to endometriosis. Does it mean that you will menopause early? You must ask yourself, your low ovarian reserve, is it just due to endometriosis or due to surgery? If it's just purely due to endometriosis, no. Actually, your reserve is still good. Your low ovarian reserve is because the toxin secreted by the endometriosis that cause your AMH to be low. But doesn't mean that your ovarian reserve is low. After you treat your endometriosis, your AMH can go up. Research has proven that after endometriosis surgery, some women actually AMH go up after 2 years. So if it's purely due to endometriosis, no. Because actually your ovarian reserve is all still there. It's just that the toxin released by the endometriosis cause many of your ovaries, that oocytes that are left behind, to be non-functional. So that's why you get a low AMH, but it's not accurate one, okay? So no. But if your low ovarian reserve is due to surgery, that means somebody did a surgery and removed a lot of your eggs together with your cysts, then maybe, but not in endometriosis purely. No. Endometriosis women, so many of them, I tell you, never menopause until don't know how old, still suffering. If endometriosis can make you menopause earlier, that ends your suffering totally. No, they still suffer. You see so many of them in their 40s, late 40s, still in pain. My Sarah asks, can we have an adenomyosis pain if we leave the cervix behind? No, cervix never have adenomyosis, but you can have endometriosis of the cervix. Let's say you have no endometriosis of the cervix, you only have adenomyosis. That's actually no problem because we can scan for endometriosis of the cervix. Alright, so not an issue. But will you have pain from other endometriosis? Yes, because sometimes you scan, you saw adenomyosis, but you may not see extra ovarian endometriosis. So when you do a surgery to remove the uterus for adenomyosis, it's best that you also need to clear all other endometriosis surrounding outside the uterus and ovary, surrounding the bowel, the ureter, your bowel, your muscle, your nerve. All those can still cause pain. Because a lot of times people just remove the uterus and the adenomyosis, but left behind a lot of other endometriosis that is not in the uterus and not in the ovary. That is why they still cause pain. So you need to remove everything. So my Sarah, I will still advise you to listen to my other videos on endometriosis to understand more details. Paris, you talk about your mother who had hysterectomy total at the age of 60 due to second-degree uterine prolapse. She made the decision despite given to repair the prolapse, but she thinks she has no longer sexual active and also want to minimize the risk of cancer. Yes, that's your mother's option, not an issue. Not an issue at all. For vaginal uterus prolapse, a lot of times also people would remove the uterus. That is her option. So as I say, I'm not saying that hysterectomy is no good. At the end, is your choice. I usually give patients options. It's not the only option. Okay, there's always options, so you can always choose. If you're happy with removing uterus, well and fine, no problem at all. Okay, but just bear in mind that ovaries are still important to you. Emily asks, do you recommend hormone tablets for long-term till menopause for endometriosis? Yes, if for me, endometriosis, all my endometriosis patients after surgery or after Visane or Lucrine will be on some form of hormone therapy until their menopause. That is my recommendation for all. Because as long as you are on some form of hormone medication, you can most likely control your endometriosis. There are many options available and I usually let them choose, but try to choose options that are only progesterone based, no estrogen. Because many women actually go on oral contraceptive pill. Oral contraceptive pills still have estrogen. I would always prefer non-estrogen hormone unless they have no other option or they prefer oral contraceptive pills. Some people just likes it. Then yes, not a problem, but please choose low dose estrogen also. Okay, it looks like today this topic don't have that many questions, but before I end my talk, just another summary. So remember, other than cancer, in most other situations, hysterectomy is not the only option. You actually have many other options to think about. But you need, before you decide on hysterectomy, you can always listen to all the other options. Ultimately, the option is yours. And for hysterectomy, you can have subtotal. You can have total. You can also remove one ovary with your uterus. You can also remove 2 ovaries with your uterus. And last of all, option of surgery is never only open surgery for hysterectomy. You can always choose laparoscopic or robotic no matter how big your uterus is, and no matter how many times you have done the surgery, you can still do laparoscopic or robotic surgery. And you can still have the option of vaginal surgery for removing uterus in certain situations where uterus are not enlarged. Okay, so that's all for my talk today. Let me just check if there's any last question. Okay, yes, one last question from Karen. With adenomyosis in uterus, will birth control patch treatment help? Partially, because birth control patch still have estrogen. If you have adenomyosis, you should always choose pure progesterone. Okay? Alright, that's all for now. Thank you, bye-bye, and stay tuned to next Sunday. Thank you, bye.